Welcome to Night Talk.
Hi, welcome to Night Talk. Night Talk is a feed about different topics that people are interested in, and people have contacted with inquiries on those different topics. One of the most common ones is what can cause a haunting. First of all, what is a haunting? The most common definition of a haunting is when a spirit has frequent interactions with the living. Just because there is no interaction with the living in your home doesn't mean you don't have a spirit in your dwelling. Did you know that 8 out of 10 locations have at least one occupying spirit with the living? And they don't know it. They don't know that they got a spirit in their house because it doesn't interact with them. There are 20 most common causes of hauntings. Purchasing items from garage sales, estate sales, secondhand stores, or antiques. Now, 10 years ago, I went to an antique store to look around because I've never been in one. And I found this old railroad lantern. And it was really cool. You know, I thought, hey man, that's cool, I want it. So I bought it. I brought it home. About 4 days later, strange things started happening in my house. I have spirits in my house anyway, but I knew that something was different. So I started checking. I started investigating my own house again. And yeah, I did. I found a spirit that was not very friendly at all. And in order to get rid of him, I had to remove the lantern from my house. And I've got an old barn that I use for storage, and I put it up there and hung it up on the wall, and he's up there now. The process of remodeling an old house. A lot of times people will buy an old house and they'll start moving walls, replacing hardwood floors and everything else, and that has a tendency to stir up spirits, especially if one of the spirits there was the original owner. They don't like change. They don't like you messing with their homes. That is their home, and that's the way they look at it. But a lot of times, once you get done, if you ensure the spirit that they're going to like the improvement, and once you get done, if they'd like it, they'll settle down and leave you alone. Buying or renting a house where the original owner died. Now, a lot of people think that the spirit that is haunting a house, it's the original owner, died in the house. No, that's not true. That owner could have died in a car accident 500 miles away. But he wants to go home. And that's where he goes. He goes back to his house. So the idea of somebody dying in the house has caused a haunting is not true, okay? Don't let people pull that on you. The use of Ouija boards prior to or after you bought a house. Now, if you don't know anything about Ouija boards, you can go to our website, phantasm-paranormal.org. And we have a little bit on there about Ouija boards with a couple videos. But you stay away from Ouija boards. If somebody calls us and wants us to check their house out and stuff, and we found out that they used a Ouija board in there, we don't go. We don't go. People that practice different cult religions prior to or after you bought a property, okay? There's a lot of weirdos out there in this world, and they have all kinds of different cult religions that people practice and they believe in. And a lot of times, those religions, they bring in negative entities. And when you move into the house, you're stuck with it. You know, you have to get somebody to come out and get rid of it for you. And sometimes that's very hard, especially for the Catholic Church. We have a hard time getting a Catholic Church to help us on a lot of things because they want proof, okay? So we got to get them audio, we got to get them video, we got to get them sworn testimonies, we got to get all kinds of stuff. And sometimes they want somebody from the church to investigate it themselves. Well, you know, that can take years. So, but anyway, another one, the death of a family member, friend, or co-worker. People, they bind with other people. It could be a relative, a co-worker, whatever. But they get a real close relationship. And when one of them passes away, the living individual goes into a very massive grieving period. And little do they realize that their desire to have them back, to have them with them, keeps them from crossing over. Okay? I'm not saying don't grieve over the loss of a loved one. I'm not saying that. What I'm saying is you got to let go of them. You got to let them cross over. The lack of religious conviction in God. That's a big one. Most of the people in the country believe in God. And that's very helpful because it protects them. Buying or renting a home located near a cemetery or a burial ground. We've done a lot of houses where we would find spirits in them, and we would find out that out in their backyard, not too far away, is a cemetery. A lot of spirits, they will leave the cemetery and go into homes that borderline the cemetery. And they come and go. It's not like they move in and, you know, set up a house somewhere in your house. No, they don't do that. But they do come and go, a lot of them. Buying or renting a home near flowing water. People don't realize this, but flowing water, like through a creek or a stream, the molecules bang together, and in the process of doing so, they create energy, electricity, and spirits feed off of it. We've investigated along creek beds, rivers, and stuff like that, and we found a very high number of spirits alongside those banks of the rivers and the streams. And another thing, buying or renting a home near high voltage power. Spirits feed off of energy. They feed off your energy. They feed off your household energy. They feed off any energy they can get. High voltage power lines have a tendency to give them an extra kick. So a lot of people that live by high voltage power lines have a tendency to have more experiences with spirits, as far as seeing them, hearing them, or the spirit just interacting with them by moving something. Another thing, anybody that uses drugs or high quantities of alcohol, or they have an addiction to one of them, those things bring in negative energy. And a lot of times your family suffers from them. They don't necessarily see spirits and stuff, but that negative energy has a tendency to affect the family. And it's not good. Not good at all. Physical, mental, or verbal abuse from someone in the home will bring in negative spirits. There's no doubt about it. It's a fact. We've investigated places that had problems like that. And it took us a long time to find out what was going on, because most people, they don't want to talk about that. They don't want to talk about the abuse that they're suffering in their own home. They want everybody to get this opinion like, oh, my marriage is so great, you know, our relationship is so great, you know, and everything else. If your relationship sucks, get out of it, okay? There's a lot of great people out there that you can match up with. You don't need to stay around an abusive fool. High stress levels in your life. That's another good cause. It's hard to explain, but like work, school, personal relationships, high stress is another one that brings in negative energy. And it could cause some really bad family problems. Receiving and keeping family heirlooms or personal items from someone that is deceased. Photographs, wedding rings, jewelry, furniture, stuff like that. A lot of spirits get attached to items like that, and they don't want to let go of it, so they go wherever it goes. The presence of a newborn baby. The presence of a newborn baby or young child, spirits like to be around them. I'm not sure why, but they do. I personally don't know for fact, but that's what I've been told. Hi, Sandy. Hi, Teresa. Hi, Renee. No, Sandy, suicides. Okay. The Christian religion, especially, Catholics and stuff, they preach that if you commit suicide, you're not going to go to heaven. Okay? And a lot of suicide victims stay around because of that, because they're afraid of being condemned to hell. There's a lot more to it. It takes a long time to get into it. But it's actually up to the person that committed suicide whether or not they want to move on or not. And one that we've had a lot of involvement with was the desecration of burial sites by you or one of your family members. We got a call in 2003 about a spirit that was haunting a 17-year-old kid. And the spirit was only messing with him. He would see this man, he would hear the man, and the man would actually physically do things to him, to hurt him. Well, we went to the house, and we got an EVP recording from the spirit that said, "I hate him, he did it." I thought, what do you mean you hate him? He did it. So I got the boy to confess. And what happened is that him and a bunch of his friends went out to the cemetery one night, for giggles and, get a little scare in them. And the boy said, "I'm not afraid of ghosts." And he kicked over this headstone. And not only did he kick it over, but he also decided to piss on it. And that's desecration. That's showing great disrespect for a spirit. Well, the man who the grave belonged to went home with the kid, and he was punishing him for what he did. So I got the kid to tell us where it was. Okay, we got him, we got some water, we got some soap, we got some PL400, it's a type of adhesive, and we went out to the cemetery, and he showed us the grave that he kicked over. Well, we made him wash it good and clean, and when he got done, we put some PL400 on the base, and we put it back up. And I told the kid, I said, you need to apologize to this man for what you did. And he did. He did apologize very sincerely. As a matter of fact, he started crying. He was so sorry that he did it. And we went back to his house, and I dropped him off, and he never had any problems with the spirit again. Ghost hunting, trying to get a reaction from a spirit, that's not a good idea. That is a stupid thing to do. Because you can't fight something you can't see. Okay? It's not like if, you came over to my house and walked in my door, I just punch you in the face because you came in my house. Okay? No, you can't fight something you can't see. So if you go out ghost hunting and you piss off a spirit, they just might decide to follow you home and get revenge. I mean, I don't blame them. Okay? Another one. Male or female children entering puberty or in puberty. Okay? Their hormones are all screwed up. I mean, I had a daughter. I love her. I love my daughter more than anything else. But when she was going into puberty, she was crying for reasons I couldn't understand. I didn't know what was going on. And boys, they do weird stuff too when they're in puberty. I mean, they do some really off-the-wall stuff. If any of you have any teenage kids right now, you can understand where I'm coming from. But mental disorders such as schizophrenia, Parkinson's disease, Alzheimer's disease, and other forms of dementia. Last but not least, sleep paralysis. I'm going to play you a video about sleep paralysis so you get an idea of what it is, how it works, and how it affects you, okay? So let me play that video for you right now. It only takes a few minutes, so, okay?
Imagine you are just about to fall asleep and you start to count sheep in your head, when all of a sudden you feel a pressure on your chest and you sense a presence in the room. You cannot move a muscle, but you can see your surroundings and are awake and alert. This is sleep paralysis. Sleep paralysis is a momentary alertness but loss of voluntary muscle movement that occurs when you are just about to fall asleep or when you are just waking up from sleep. It can last anywhere from 20 seconds to a few minutes, and it affects about 8% of the general population. Some of the common sensations and emotions associated with sleep paralysis are an awareness of your surroundings but inability to move, a sense of physical weight and pressure on the chest, difficulty breathing or a choking feeling, hallucinations or a sensed presence, and an overwhelming sense of fear or dread. Some people even describe hearing footsteps getting closer, seeing intruders, demons, or spirits, and feeling as if they are about to die. Although there is no physical danger to the person experiencing sleep paralysis, they cannot pull themselves out of it and must wait for it to pass. Sleep paralysis is different from nightmares or night terrors in that the brain is awake but the body is in its sleep state and thus cannot move. What is most interesting about sleep paralysis is that it dates back to the 10th century and is prevalent in all ethnicities. In fact, people from many cultures have used sleep paralysis as a way to explain supernatural events and beings, such as witchcraft, ghosts, and alien abduction. Now, let's go into detail of what sleep paralysis really is. There are two types of sleep paralysis, hypnagogic and hypnopompic. These two terms refer to the difference in time at which sleep paralysis occurs. Hypnagogic, also known as predormital, is when sleep paralysis occurs at sleep onset or just before falling asleep. On the other hand, hypnopompic, also known as postdormital, refers to sleep paralysis that occurs just after waking up, at the transition from sleep to awakening. In order to understand how sleep paralysis occurs, we have to understand what REM sleep is. During sleep, your brain cycles through 5 different phases: Stage 1, Stage 2, Stage 3, Stage 4, and Stage 5, which is called Rapid Eye Movement Stage, or REM for short. A REM sleep cycle consists of 25% of your sleep, which may occur several times throughout the night since your sleep cycle is repeated. REM is important because this is when dreaming occurs and when your body becomes energized. During REM, signals are sent to your spinal cord and motor neurons to shut off movement, creating a temporary inability to move the muscles of your arms and legs. This serves as a protective measure to prevent you from injuring yourself or others while you dream. Now that we have an understanding of what REM sleep is, let's talk about its importance to sleep paralysis. Sleep paralysis is thought to occur due to an error in the flip-flop switch controlling REM sleep. REM sleep is thought to work as a switch between 2 stages, REM on when REM occurs and REM off when it does not. This mechanism allows for smooth transitions into and out of REM sleep. This REM switch works in opposition to the wake-sleep switch. Normally, REM on occurs at the same time you are asleep. However, when sleep paralysis occurs, the neurons controlling the wake side of the wake-sleep switch and the neurons controlling the REM off side of the REM switch are weakened. This allows the REM on neurons to prevent muscle movement while the body is somewhat awake, which should not be happening. This can cause sleep paralysis. Experiencing negative emotions is another common occurrence during REM sleep. This is because the area of the brain known as the amygdala, which is important in fear processing, is active throughout REM sleep. Since it is active during REM and is closely associated with fear, it is thought to facilitate the generation of anxiety and fear during sleep paralysis. So, how do you avoid sleep paralysis? There are a number of factors that contribute to your likelihood of experiencing it. A twin study conducted on 862 participants showed that genetics are at least partially to blame for sleep paralysis, with researchers finding that genes accounted for 53% of the occurrence of sleep paralysis. If you have a sleep disorder, you're also most likely to experience sleep paralysis. Sleep paralysis is a common symptom of a sleeping disorder called narcolepsy, which is characterized by excessive and uncontrollable daytime sleepiness. Sleep paralysis is also most likely to occur if you sleep on your back and if you regularly don't get enough sleep. In general, poor mental health is associated with sleep paralysis. Higher scores on self-reported measures of depressed mood and anxiety have been associated with sleep paralysis. Research focusing on sleep paralysis in patients with PTSD showed higher prevalence as well, and another study has linked bipolar disorder to sleep paralysis. As we have seen, there are a number of factors associated with sleep paralysis, like genetics, poor sleep, sleeping disorders, and poor mental wellness. Aside from avoiding or treating these specific risk factors, are there other treatments that could work for avoiding sleep paralysis? Well, there is no universal treatment that works for treating sleep paralysis. There are preventative and management strategies. However, these strategies lack empirical consensus among researchers. Some researchers have suggested that treating underlying sleep-related disorders or mental illness disorders may help with preventing occurrence of sleep paralysis, and some pharmaceutical drugs, such as antidepressants, may help in managing sleep paralysis due to their REM-suppressing properties. Additional preventative strategies for sleep paralysis include having optimal sleep hygiene, avoiding alcohol and caffeine before bed, and incorporating pre-sleep relaxation practices into your nightly routine. Although experiencing sleep paralysis can be extremely frightful, There are no immediate dangers or health risks associated with it. We hope that you were able to learn something from this video, and we ask that you please subscribe to our Demystifying Medicine YouTube channel for more videos.
Okay, before I go on, Sandy asked me a question. Is it okay that her daughter sets a recorder to catch her deceased boyfriend's voice? Sandy, to be honest with you, it's not a good idea, because what's happening is your daughter is keeping him from crossing over. In one of these episodes, I'm going to talk about cemeteries and a bunch of other stuff, and it's going to explain in more detail about why spirits need to cross over, but I'm not going to go into that now. But like, as you know, my wife died. I talked about it in one of my past feeds, and I loved that woman more than anything. We were only married like not even 7 years before she died, and I didn't get married until I was 33 because I didn't want to get married. I didn't want to have kids. I didn't want to have a wife. I had all the girlfriends I needed. I was a hell of a good-looking guy back then. Now I'm just an old guy. But the best thing for her to do is tell him that he needs to cross over. And she can tell him, things like, I love you very much and I miss you dearly, but you need to cross over. You need to be happy. Her pain and her loss is keeping him back. And it's very hard to let go of him. It takes time to get over the pain and the anguish and everything else. But it's best that you just let him go and tell him that, I love you, but you need to go. You need to be happy again. But anyway, let's move on. I have 3 more videos to show you about mental illness. Schizophrenia is 2 minutes long. Parkinson's disease is 7 minutes long. And Alzheimer's disease is 4 minutes long. If you guys have any questions, feel free to ask them. Type in your questions. And after each video is shown, I will answer as many questions as I can. How's that sound? Does that sound good for you guys? Type in amen if you go for it. But anyway, I'm going to start playing Schizophrenia. And, did you know schizophrenia affects an estimated 3.2 million Americans every year? That's an astonishing number of people that suffer from this disorder, considering there's only 325.7 million Americans that were counted in the U.S. population in 2017. More than 70% of the population with this illness have visual hallucinations. 60 to 90% of them hear voices. But some of them may also experience hallucinations involving smell and taste at the same time. So let me play Schizophrenia for you. If you have any questions, feel free to ask them, and after this video, I'll answer as many as I can, okay?
Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Petersburg, Florida. I'd like to talk a little bit about schizophrenia. What is schizophrenia? Schizophrenia really is a chronic, severe, and debilitating brain disease. It affects probably about 1% of the population. In the U.S., at any given time, there's 20 2 million people that are diagnosed with schizophrenia in any given year. Seems to occur as frequently in men as it does with women, but with men, the age of onset seems to be a little bit earlier. I found that in my practice too. Most of the first symptoms or psychotic break that a person experiences with men, usually in their early 20s. Sometimes with women, it can be in their 30s and even 40s, but they can be their early 20s too. Higher percentage of men definitely have earlier onset of symptoms. Schizophrenia usually from a public standpoint tends to be the crazies or the homeless people. Schizophrenia, really, we're not sure what causes it. There's definitely some neurotransmitters that are indicated, and research is being done by that. But what you usually see, the behavior associated with schizophrenia, is very bizarre behavior, including disorganized speech, thoughts that are fleeting or disorganized, hallucinations or delusions. Most people think of schizophrenics as the paranoid type, a paranoid schizophrenic that's hearing, that's having signals from Mars sent in through his fillings on his teeth. It's kind of a humorous way to look at it, but that's how bizarre some of the symptoms represent themselves in somebody with schizophrenia. So overall, we want to look at schizophrenia as probably one of the most severe brain disorders or form of mental illness that there is, and it can be confused sometimes with severe bipolar disorder or major depression. My name's John Bosworth, and I'm talking about what is schizophrenia. Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Petersburg, Florida. I'd like to talk a little bit about schizophrenia. What is schizophrenia? Schizophrenia
We had a
really is a
mishap with
chronic,
the internet.
severe,
Sorry
and
about that.
debilitating brain disease. It affects probably about 1% of the population. In the U.S., at any given time, there's 2 million people that are diagnosed with schizophrenia in any given year. Seems to occur as frequently in men as it does with women, but with men, the age of onset seems to be a little bit earlier. I found that in my practice too. Most of the first symptoms or psychotic break that a person experiences with men, usually in their early 20s. Sometimes with women, it can be in their 30s and even 40s, but they can be their early 20s too. Higher percentage of men definitely have earlier onset of symptoms. Schizophrenia, usually from a public standpoint, tends to be the crazies or the homeless people. Schizophrenia, really, we're not sure what causes it. There's definitely some neurotransmitters that are indicated, and research is being done by that. But what you usually see, the behavior associated with schizophrenia, is very bizarre behavior, including disorganized speech, thoughts that are fleeting or disorganized, hallucinations or delusions. Most people think of schizophrenics as the paranoid type, a paranoid schizophrenic that's hearing, that's having signals from Mars sent in through his fillings on his teeth. It's kind of a humorous way to look at it, but that's how bizarre some of the symptoms represent themselves in somebody with schizophrenia. So overall, we want to look at schizophrenia as probably one of the most severe brain disorders or form of mental illness that there is, and it can be confused sometimes with severe bipolar disorder or major depression. My name's John Bosworth, and I'm talking about what is schizophrenia.
Okay. Now, let me talk to you about something. Mark, hey, I gotta agree with you, buddy. It's hard to let go of somebody that you love, and I feel for you, buddy. I lost a wife. I couldn't imagine what it's like to lose a daughter, but I'm just sorry to hear about that. Oh, by the way, our internet is microwave, and the microwave tower is 5 miles away. Sometimes when the temperature's extremely cold like it is now, we have a tendency to get a slight interruption in our internet, and that's what happened. That's what caused that hiccup. But anyway, sorry about that. I wish we had a direct line with our internet, but we don't. Where I live out in the country. I mean, I live out in the country. I live out in the boondocks. And they don't have cable out here for internet. So we got to deal with what we got and hope one of these days they get a line ran out to us. But anyway, let's move on. Parkinson's disease. Up to half of these people who have Parkinson's disease sometimes see things that aren't there, such as people, common or strange looking animals, and sometimes even monsters. But to them, they are real. I used to know somebody that had Parkinson's disease, and she was a fantastic old woman. And she had some real bad issues with it. But anyway, I'm going to show you the video about Parkinson's. And if you have any questions, please feel free to ask, okay? Or if you have any comments, and after this video, I'll, get to them for you, okay?
So Parkinson's disease is a neurodegenerative condition. What does that mean? That means that there is damage to certain parts of the brain called the basal ganglia, which we do not know what causes that problem. In about 5 to 10% of cases, it's genetic, but the other 95 to 90% of cases is idiopathic. This comes out of the blue. We don't know what causes it. If there's a family member with Parkinson's disease, it slightly raises your risk of getting it, but just by a little bit. The cells start to become damaged, and then that continues over time. And we don't have a medication or a drug or any way of curing that or stopping it or even slowing it down. We don't have any treatments like that definitively at this point in time. So often, the often typical first symptoms that people might experience is some tremor, usually tremor in one hand when the hand's resting, or stiffness, slowness, or some loss of balance. Their friends or family or themselves may notice that their voice is becoming a little bit softer, their facial expression is changing, becoming a little bit more masked, so not as expressive as it used to be. They may start drooling, having a little bit of extra saliva. So they're often the first things people notice or the patient notices themselves. Then other things that can come early on is loss of sense of smell, constipation, sometimes some urinary trouble, urinating a little bit more frequently than usual. And there's a couple of other things too that may happen early, which is anxiety or depression, maybe one of the early things, and just changes in sleep. So, for example, starting to act out their dreams, yelling out in their sleep, kicking out and punching in their sleep is a symptom of Parkinson's. And that can potentially lead to them falling out of bed or injuring their bed partner accidentally. So that's one thing to look for. So when you see your physician, either a primary care physician or a neurologist, there's things that they look for in the history. So in the symptoms that you have that will clue them in that this could be Parkinson's disease, and then the examination will confirm those findings. So it's really a clinical diagnosis, it's history and examination. Your doctor might order some additional tests, such as an MRI scan or a CT scan of the head, and maybe some blood work if they think that's necessary, and that's just to rule out potentially other mimicking conditions. There's also things they'll ask you about regarding medications that sometimes can mimic Parkinson's, but they're the main things to rule out, and then it's really a clinical diagnosis. We don't have a blood test or any other test that will definitely confirm this is Parkinson's disease. Well, there's lots of treatments to help Parkinson's disease. So in the early stages, the symptoms, the tremor, stiffness, slowness, respond really well to medications. Levodopa, so carbidopa, levodopa, or Sinemet is a very effective medication to help those symptoms. And there's several other medications along those lines that mimic levodopa that can have a similar effect. So there's lots of things that can help. And then regarding what we call the non-motor symptoms, so things like constipation, urinary symptoms, mood disorders, sleep problems, and so on, there's lots of medications that can be used to treat those symptoms. So it's very important that you can empower yourself to improve your overall health and overall well-being in terms of how you will interact with this diagnosis. So the things that will help Parkinson's disease are ensuring adequate sleep, ensuring a healthy diet, and exercise. And exercise is almost as good as a medication in that it can help a lot of symptoms and also potentially slow the progression of Parkinson's disease. So that's a possibility, not yet proven. But exercise will help things like improving sleep quality, improving mood, improving constipation, improving stiffness, improving balance. So of all of those things, exercise will get at better than so it's almost like one medication to cover all of those aspects. As Parkinson's disease progresses, the symptoms we talked about, tremor, stiffness, slowness, loss of balance, can progress too. And other symptoms can come out. So problems with memory, problems with hallucinations, problems with speech becoming more difficult to understand, problems with swallowing. And the things that can get people into trouble down the line is problems with swallowing, so you choke on food and get an pneumonia, or falling and breaking a bone, and falling and or hitting your head. And those complications are things we try to avoid, because they're the things that ultimately will can cause problems. As long as we can prevent those from happening and make sure that swallowing is safe and balance and mobility is safe, we generally avoid a lot of the complications of Parkinson's disease. Over time, as patients are on medication, they may start to feel the medicines kick in and wear off. That's called motor fluctuations. So they feel good, and then they feel like their symptoms are back. And they can seesaw between those two states, and that can be disabling. Another problem is dyskinesia. So it's usually related to medication. When the medication kicks in, people get some wriggly movements. Sometimes they're mild, sometimes they're more dramatic. But they can be treated with certain medications. And the third thing is sometimes tremor is hard to control with medications alone. So for one of those three problems, deep brain stimulation is very effective. And deep brain stimulation is used now more and more frequently to help treat the symptoms of Parkinson's disease, specifically those three symptoms. And it's done in select patients where it's felt to be of benefit. Before medication was available, it really impacted survival, because basically patients are becoming very stiff, frozen, and bedbound, and then that wasn't a good situation. Now with medications to make sure that stiffness, slowness, and tremor is controlled and patients can maintain mobility, and that has a huge translation into survival and doing well. So you're maintaining independence, trying to maintain as best a quality of life as possible. So everybody is different who develops Parkinson's disease. In some people it can be slowly progressive, or some people it can progress more rapidly. We don't have any way at the moment of predicting that, but there are patients with Parkinson's disease who've lived 20 years or more with the disease, and we're seeing that more and more.
Okay, I just found out I gotta go somewhere tonight. I gotta drive 100 miles tonight, one way, to go see somebody. So I'm gonna have to cut this a little bit shorter. The next video I'm gonna play is different forms of dementia. If anybody has any questions, please ask them. Don't be shy, okay? So let me get this one sped up, and then we'll talk a little bit more, okay?
My name is Sebastian Crutch. I'm a clinical psychologist and neuropsychologist working at the Dementia Research Centre at the UCL Institute of Neurology. Dementia is a syndrome, if you like. It's a group of progressive cognitive disorders, so problems of higher brain skills such as memory, and thinking, and language and perception, seeing things clearly, which comes together. And it can be caused by a whole variety of different diseases, but dementia can be very varied in how it presents itself. So Alzheimer's disease is the most common form of dementia and probably affects about 2/3 of people who have a dementia syndrome. But there are other quite common diseases such as vascular dementia, which is where the dementia is caused by changes in the vascular system, the blood supply to the brain. It can be thought of in some instances as being like a series of mini strokes, which can gradually affect people and gradually take a toll on perhaps their memory or their ability to process information quickly. Another condition which affects some people, particularly older people, is a condition called dementia with Lewy bodies, where it's a slightly different pathological change, so slightly different changes going on amongst the brain cells, but the impact is somewhere between Alzheimer's disease and Parkinson's disease, in the sense that people have difficulty with their memory and with their perception, but also they have some features of Parkinsonism in the sense of slowed walking and some stiffness, and often they have falls, and hallucinations are very, very common. There are other conditions which again affect different groups of the population. So there's a condition called frontotemporal dementia, which actually encompasses several different diseases, but tends to affect either behaviour or language quite early on, and often affects younger people, so is often more commonly found in people under the age of 65 than a condition such as Alzheimer's disease. For many people, the first signs of dementia can be quite difficult to identify because it comes on very subtly, and often people are in it for a year or two might have some odd behaviours or difficulties that they're experiencing that they can't quite put their finger on, they don't quite understand why it's happening to them. So often people who have early stage dementia will present to their GP, or perhaps a family member will actually go to the GP saying, I'm concerned about my father or my husband. And the changes can be quite varied. In typical Alzheimer's disease, it's often instances of forgetting a particular event, of misplacing items, of being slightly confused or needing to ask questions repetitively in order to get the information because it hasn't been retained properly. But depending on the type of dementia and the disease underpinning the condition, then the symptoms can vary. Sometimes it might be that you're having difficulties finding words for things. Sometimes it might be that you're having subtle difficulties perceiving things. So my particular research is interested in why Alzheimer's disease can express itself in so many different ways. I think if you ask most people, if you say Alzheimer's disease to them, they immediately think of perhaps a much older person who's confused and got memory problems. But actually Alzheimer's disease can also affect people's language, it can affect people's perception, and depending on which parts of the brain are affected first by the Alzheimer's disease, that can dictate which area of their skills take the brunt of the damage early on. So I'm particularly interested in working with a group of people who have a condition called posterior cortical atrophy, which literally means back of the brain shrinkage. The characteristic symptoms of which are early changes in visual perception and spatial perception, so seeing what things are and seeing where they are. And by working with and understanding the differences between the typical Alzheimer's disease and these rarer variants, such as the visual variant of Alzheimer's disease, we can try to underpin some of the factors which drive the pathology, the disease, to affect particular brain regions. And if we can understand those factors, then those might be things that we can target either with medications or with therapies to try to prevent them in the future.
I know a lot of people, they don't like watching videos, but I'm one of those type of people that I want to put to you as much evidence and proof and explanations for things so you'll understand them more. I'm not one of those kind of guys that say, hey, this is the way it is, believe me, No, I don't pull that stuff. Let me talk to you about something else. When investigating a haunting, there are several questions you need to ask the people that are involved And sometimes the questions get quite personal, but they are necessary. And one of them is, does anybody in your family have mental disorders, or anybody in your family have a history of mental disorders? Sometimes when I ask that question, people really just, what? But it's something that needs to be asked. And it's not easy to ask somebody that. And quite a few people have replied yes, and they tell me about their grandpa or whatever. There are several types of hallucinations that a wide variety, I have a hard time saying that word, that a wide variety of people experience, such as audible, sight, smell, taste, and feeling. If you're like most people, you don't think hallucinations as somebody seeing things that aren't there, but there's a lot more to it than that, give me a break here. One of the most common types of hallucinations is visual hallucinations. When someone thinks they see someone or something, but it's not really there, it's just in their mind. Hallucinations can also be audible, such as hearing voices. Doctors refer to that type of hallucinations as auditory hallucinations. Quite often, these type of hallucinations appear to people talking to others that aren't there, directly, like Uncle Joe's over in the corner talking to somebody that's not there, what's the matter with them? There are other hallucinations, including smell, taste, and feelings. Hallucinations that involve smell are referred to by doctors as olfactory hallucinations. This is where someone thinks that something they are eating or drinking has an odd taste or smell to it. Hallucinations which involve taste are referred to as gustatory hallucinations. Some of these words, when you don't use them every day, they're kind of hard to pronounce. It's quite similar to olfactory hallucinations. It's when you're eating something or drinking something and you think it tastes strange or odd. You might be drinking a cup of coffee and think it tastes like iced tea. It happens. Last but not least is feeling things. Physicians refer to this type of hallucinations as tactile hallucinations. For example, you might have a sensation of insects crawling on your skin or even under your skin. Some people also experience the feeling of being touched or tickled. Even though you may think someone is just hallucinating, doesn't mean that they are. They could actually be seeing and hearing spirits. If you have any questions, please contact us. Down at the bottom, down here, right there, is the email address that you can contact if you have any questions, or if there's a topic that you would like to discuss. Right now, I'm trying to set this program up. I use OSB, and right now I'm trying to set it up where I can do interviews with other people. They can use their phone and everything can be, broadcast live, but I'm just learning this program and it's quite difficult. So, does anybody have any questions, any comments, any suggestions about our programming? I'm willing to listen. But anyway, like I said, I got to travel 100 miles and I got to leave here no later than 9:30. And I'm going to be up there for a couple hours, and I'm going to be driving 100 miles back. So my behind is going to be dragging tomorrow. But if you guys like this feed, please tell other people about it. And like I say, I apologize for the hiccup with the internet tonight. It's something that I just have to deal with. But I appreciate you guys coming here and listening to me babble on. So you have a good night, and I will talk to you guys later.
You're gonna come back and see us, aren't you? You better be. We need you. We gotta have you. We depend on you. Come on back and see us. The feed is over. Sleep well.